Good morning. Welcome to Hot Seat. My guest was no stranger to weekends here, Senator Paul Rosino. Good to see you.
Thank you. Nice to be here.
In the past few weeks, there has been a ton of information about mental health services in Oklahoma, the agency specifically. So as we begin May, where are we at in terms of the investigation, service to people that need the services, and where you see this headed?
So it's been frustrating. I think the Department of Mental Health has made some big mistakes. I don't think that they currently have the right staff that can understand the depth of what's going on with their budget. I think that people in Oklahoma desire mental health services to be readily available when they need them. I think that people in Oklahoma are using our services, and when we cut them off or we don't have them, it really becomes a problem. I'm really worried whether or not we're going to have a budget or the legislature is going to have to get involved to make them have a budget, because I don't know if they can do it themselves.
So I've covered this a lot over the years. I mean, many times on Hot Seat, and it's always very difficult to understand how the system works. We're seeing about providers, some have some big salaries for the CEOs. There are 4 separate investigations. So let me start on the ground level. Are the folks who need services in Oklahoma being served right now?
I would say yes. I think, but to your point, I think there's a lot of confusion, right? Providers get a notice that they were going to get their rates cut, and then they pull that back and say, no, your rates are not going to be cut. Well, if you cut rates, what the first thing providers do is say, we can't provide services to people. So I think it scared some people. That got pulled back. The investigations are a hindrance, I think. We have 4 of them going on. The governor's got one, the state auditor's got one, we have Loft involved, and then the House of Representatives just did one. And we're all getting the same answer. It's not like there's a whole new roll of information. It just sounds like they just are confused and don't really have a grasp on what's happening within their finance department at the Department of Mental Health.
One of the things in my conversations with some of the providers and the folks that have worked there over the years is y'all just haven't done a good job explaining the system and how you can engage the public in advocating for them. Is it that way with the legislature? Is it still kind of people don't really understand how this whole bureaucracy works?
Well, I think some people at the legislature don't. They know the surface part of it, but when you start getting really into scope and depth of what you have to do to form a budget and how you have to have these relationships with these agencies to make sure that they understand and you understand what they need and what they want. And that's where I think there's some real confusion with the Department of Mental Health, because they've come with several different numbers. We can't really drill down because they haven't been forthright with all the information. Or if they are forthright, then they'll back up and say, well, that's not really what we meant. And so we've seen numbers as much as 96 million. We saw 48 million. We saw 32 million. And now they have a supplemental they're asking for 6.2 million. I am still under the impression that they don't really need any money. They just cannot figure out where all their funding is.
All right, with 1 month to go, and you've got all kinds of budget challenges, right? Trying to figure out how the federal thing is going to impact Oklahoma. So how does the pro tem and the speaker and the A and B chairs and the subcommittee chairs on this, how do you get to some place that you need to be to agree on a budget when you can't agree on how much money there is?
So I think we do have an agreement on how much money there is. I think, Senator Hall, who's our appropriation chair, working with his House counterpart, they know where we can be and what we have. And I think you're going to see, at least from the Senate side, I don't want to speak for the House, but on the Senate side, we are going to try to keep spending down as small as we can and keep budgets as flat as we can to ensure that Oklahomans are still taken care of and still have services, but at the same time, we're not spending all our savings.
Senator Paul Rosino is the chair of Health and Human Services out at the Oklahoma State Senate, and it is May, which means it's going to get real interesting. Thanks for being here, Senator.
Thank you for having me.
And thanks for watching Hot Seat. See this again at news9.com and news16.com, where you can see the full interview with Senator Rosino.